All right, well, thank you for having us today. I'm really excited to tell you a little bit about the work that is happening in Georgia between Children's Healthcare of Atlanta and our partners in Gwinnett County Government. Next slide, please. So I just want to orient the audience because I come from a healthcare institute, and oftentimes when working with out of school time, just kind of giving them some insight as to how, as a healthcare partner, we can contribute to the health and well-being on the community level. And I think one of the things that I am so inspired by working at Children's and Healthcare of Atlanta is really just our mission. And this is our hospital mission, to make kids better today and healthier tomorrow. So of course, we as a hospital, we're the largest pediatric healthcare system in Georgia. We are taking care of sick kids, and that's our primary business. But really, my team with Strong for Life is fortunate to be the healthier tomorrow piece of our hospital mission. So Strong for Life is the name of my team, whose mission is to really help families raise healthy, safe, resilient kids. And we do that through a variety of partnerships with community level influences on children. So thinking about this circle graphic that you see here on the side is really rooted in the socio-ecological model of health, with the child and the family at the center of the model, and then the layers of influence around that child. These are the environments and the spaces where kids live, learn, and play. I know we hear that quite often. So my team is comprised of doctors, therapists, dietitians, exercise physiologists, and folks who are in that space of public health and are doing this outreach outside of the walls of our hospital system to impact the health and well-being of all kids. We certainly do work with schools and early care centers, with our primary care healthcare audience across the state of Georgia, but then also have this tremendous opportunity to impact the well-being of children through our community partnerships in that out-of-school time space. Next slide, please. And one of the things that I talk about quite a bit is just the fact that as a nonprofit healthcare system, we are required by the IRS to maintain our nonprofit status to conduct a community health needs assessment every 3 years. So what you see on the slide here is probably not surprising, considering the Mentimeter that we did just a while ago, but these are the results of our 2022 community health needs assessment for Children's Healthcare of Atlanta. And this is a robust process where we really are gathering feedback from key stakeholders who impact children and impact the well-being of children and adolescents across the state of Georgia. So we're talking to the healthcare sector, we're talking to school leaders across the state, we're talking to out-of-school time leaders across the state, and gathering that feedback to help us determine what are these priority health needs that we need to dedicate our community prevention budget to help have an impact on. So as you can see, not surprising that behavioral health and mental health is definitely top of that list for community health needs. I don't think that is unique to Georgia in any way, shape, or form, followed closely by chronic diseases, which does include things like diabetes and obesity and asthma, adolescent health issues, which are many of the things that were mentioned on the Mentimeter as well, child obesity, injury prevention, infectious disease, community outreach, just primary care medical homes, health literacy, and then oral health. So I think sometimes when I'm working with community partners, they're like, well, this is great, but how does this really connect back to our partnership and to our work with you? And I think one of the things I hope that many of you will get out of this today is to think about your local healthcare system and think about your local hospital and the fact that they need to identify these needs. And it's a tremendous opportunity for partnership on the community level. And out of school time partnerships are top priority in this space when we think about the volume of kids that have access to out of school time programs and the time spent there. And how can we collaborate in a way that we are implementing these HEPA standards that would help impact these top community health needs as well. Next slide, please. So with Strong for Life, we really have these 4 healthy habits that we promote across all of our sectors. So whether we're at the pediatrician's office, or we're in a school, or we're at our Park and Rec department with Lindsey, who will tell you a little bit about what this looks like in that setting, we have these consistent messages because we believe that healthy habits are for all kids. Healthy habits are not just for kids who are obese or kids who are struggling with their weight, but healthy habits are for all kids. And certainly the impetus behind development of some of these healthy habits, which I know Let's Go will show you their version of this as well, maybe started with the obesity epidemic over a decade ago, but has really morphed and evolved to including emotional wellness and well-being, talking about sleep and the importance of that. And how does this factor in and contribute to our kids' improved well-being overall, which includes their ability to learn when they show up at school each day, lowers their risk for disease in the future, and really gets us to that right side here, happier, healthier kids. But more importantly, these are children and adolescents that are more productive citizens and are able then to return back to the community and have an impact in the community in a positive way. So this has really been the impetus for some of our partnership and our work with Gwinnett County and the work that's happened with Live Healthy Gwinnett. Lindsey's going to tell you a little bit about how our partnership really started and has evolved over the years. But I just want to reiterate from that healthcare perspective, this is important to us to help encourage kids to be happy and healthy. It's important to all of us in our school time as well. So how do we bring those two pieces together for equitable impact among our kids? So I'll hand it off to Lindsey.
Perfect. Thanks, Wendy. Anna, if I can get the next slide. Great. Good afternoon, everyone. Happier, healthier kids connects into our vision of being the preferred community where everyone thrives. Roughly 40 miles northeast of Atlanta, Gwinnett County is home to over 950,000 residents and is known as one of the most diverse counties in the Southeast. Being healthy matters in Gwinnett, and in 2014, our county government helped establish Live Healthy Gwinnett out of its Parks and Recreation Division. According to our past community health assessment, Gwinnett's obesity rate places a quarter of the adult population at a higher risk for serious conditions, as Wendy mentioned, diabetes, heart disease, cancer, respiratory problems, and stroke. It is also known by the assessment that over 20% of our residents get no leisure time physical activity. We don't want our youth today to participate in those same unhealthy habits that they may be observing from their adult role models. So we must intervene with the wellness standards and positive relationships mentioned before. Live Healthy Gwinnett takes on that proactive wellness approach to address the preventable chronic illnesses. Through community education, people can significantly reduce their risk of developing those chronic diseases by making very simple lifestyle changes, eating healthy, increasing their physical activity, taking advantage of preventative screenings, and reducing stress. This is all done through year-round partnerships, providing free programs and events that focus on our 4 areas of wellness pictured on the screen. Next slide, please. So what do we use to educate our leadership to support health equity work in Gwinnett? Being founded in Parks and Recreation, we truly believe that parks are the common denominator in which all populations should have fair and just access to the quality experiences. The National Recreation and Park Association's pillars help guide our efforts, especially their wellness pillar. In Gwinnett, we aim to cultivate a safe, livable, and healthy community by providing programs and services that address basic human needs, including housing, healthcare, and food security. And alongside community partners like Strong for Life, we make critical services accessible to those in need while focusing on moving that needle more towards equitable service deliveries that ultimately improve the health of our community. Following today's session, I do challenge all of you on the call who may just now be becoming aware of the National After School Association and the HEPA standards to really review with your teams and leverage the assessment tools to determine first steps of implementation. In addition to NAA's resources, I do challenge you to connect with your local or state out-of-school time affiliates. Here in Gwinnett, we work with the Georgia Statewide After School Network and our local positive youth development experts from Gwinnett United and Drug Education, or what we lovingly refer to them as GUIDE. They've established the Georgia After School and Youth Development Standards, which build upon those national best practices heard today. Next slide, please. With that being said, Live Healthy Gwinnett would not be where it is today without our healthcare champions like Strong for Life. They helped us personally establish our health and wellness standards from the get-go. These are written commitments that we agree to follow to provide environments that promote healthy habits for adults and children where they live, work, and play. These commitments include offering a variety of planned physical activities for persons of all ages and all abilities, access to healthy food and beverage options, especially in our out-of-school time programs, in our vending contracts, in our concession stands, implementing partnerships that support the well-being of our users and of our staff, leveraging tobacco-free park systems, and more. These standards dive deeper into catering guidelines for user groups, concussion and head injury procedures, and expansion of our out-of-school time promises, like 60 plus minutes of physical activity daily, nutrition education, limiting of screen time, an array of caregiver support, and mental health resources, especially for our amazing staff and team members. I know it was opened up today about the amazing professionals in this field, and they too must be supported along with our residents. Next slide. So how do we know if our health equity strategies are making a difference? What's pictured on the screen is our community health dashboard located at livehealthygwinnetdata.com. This is where we leverage our up-to-date demographics, our education, our environmental concerns, economic, health, social determinant, and equality data that highlights trends and challenges that we're seeing in our communities. In a county as diverse as we are, we found that certain out-of-school time strategies work better than others, primarily mobile services, bringing recreation to play deserts, nutrition education and hands-on gardening to food deserts, and early learning and literacy to book deserts. You get the idea. We've got a lot of gaps across our communities. And ultimately, we are trying to meet our residents where they are while still offering our flagship programs at our traditional out-of-school time sites. Next slide, please. Wendy, do you want to kick us off on some of the initiatives we've been able to accomplish together?
Yeah, absolutely. So I think I spoke more broadly about health and well-being, and then Lindsey gave you some really specific examples of how that's been embedded into the county standards and the county policies that are being followed at all of the things that occur through these Parks and Rec departments. So what you see on the screen here are just some examples. We love to take pictures when we're out in the community. Hope and Will are our mascots at Children's Healthcare of Atlanta. So we have a water safety partnership with Gwinnet County, as they have pools at many of their park locations during the summer months. You see some supplies there for a sugar demonstration kit. That's some of the nutrition education that our team has helped develop, package, and kit and hand off to the Parks and Rec professionals who are implementing summer camp programs and able to do these fun activities with kids to teach them about choosing lower sugar beverages and drinking more water. And then you also see lots of examples of signage as well. It's been a tremendous opportunity. We have the most amazing park system in the country. I tell folks this all the time here in Gwinnett County, and our families spend a tremendous amount of time there. So one of the things that we do invest in is signage and campaigns and messages so that they are front of mind for families as they are out playing, to drink more water. Or the sign that you see there, to take a breath, has a QR code, and we have some guided meditation and guided activities that families can do while they're at the park together as well. So those are some of the examples there of activities that we have done with Parks and Rec folks. Lindsey, did you want to add anything on this one?
Just to add some of the Camp Healthy Habit messaging, Strong for Life has connected with us on our caregiver newsletters, our bulletin board kits. If we can advance to the next slide. Yep. It shows some of the staff trainings that they've put together and curriculums built that our volunteer camp aides are trained on, our camp staff, our health and wellness public interns through Live Healthy Gwinnett. A lot of this language is embedded into our habits so that our staff are the best role models in any type of out of school time program for participants.
Yeah, absolutely. Those wellness warriors you see there, that was an incentive. We wanted to recognize staff who were role modeling and championing the habits that we trained them on. So if you were caught drinking water in front of the students, or if you were caught eating fruits and vegetables or engaging in a fun way, you were given this wellness warrior award. So it was a way to motivate the staff as well to really take ownership of their responsibility as role models and leaders for these young adolescents and for these children as well. And we really enjoy having that opportunity to come to these groups and provide training on these core nutrition messages and physical activity messages, and helping them recognize the role they have to influence that while they have time with the kids as well. Next slide, please. I think as Lindsey and I were just kind of talking through, what do we hope folks take out of our presentation today? Really, from my perspective, from a healthcare system, was really to think about, are you partnering with them? Are you partnering with your local experts who are dedicated and committed to improving child well-being in your community and making use of those? I have a fabulous team, and they want nothing more to go out in the community and spread those messages and work with these partners. And then our reward is really seeing that in action with great collaborations like we have with Gwinnett County. So I encourage everyone to leverage your local healthcare system when you can.
Perfect. And my last point was to find your change makers, your local change makers. Partnerships play a major role, whether it's after school program, a summer meals distribution, caregiver support. We must have those built relationships. Here in Gwinnett County, we rely on some trusted leaders in many of our underserved communities to be our health champions and invite our teams in to collaborate. This has been very successful in taking our out of school time programming mobile into mobile home communities, apartment complexes, extended stay hotels, co-ops, faith-based partners, you name it. Definitely find your connection points.